Welcome, ladies and gentlemen, to Forensic 101, the channel where the dead do the talking and the toxins keep on walking. The topic of discussion for today is true versus false insanity. Now, this is a relatively important topic from the theoretical point of view. As a doctor, you may be called on by the court of law to examine and report on an individual who may complain that he is suffering from one or the other type of mental illness. The court expects that you, as a registered medical practitioner, are able to effectively identify whether the mental illness is true or is it feigned for the purposes of determining whether prosecution of this individual is to be done. Feigning mental illnesses or criminal malingering, as it is called, is defined as producing false symptoms with an ulterior motive like financial compensation, getting access to housing, drugs, avoiding work, military duty, prosecution, or for bugging out of contracts. In the year 2017 alone, more than 6,300 cases were reported as being examined or sent for examination for the purposes of criminal malingering. Let me tell you a story. How many of you have read the epic novel by Mario Puzo titled The Godfather? I mean, at least you must have seen the movie. Now, The Godfather is a title given to heads of Italian criminal syndicates. A real-life criminal was bestowed with a similar title, but with a slight difference. He was called as the Odd Father, ODD. I am talking about the late Vincent Gigante, who was the mafia boss of the Genovese crime family in New York State, USA. He eluded prison by faking mental illness and its symptoms for almost 3 decades. He displayed signs such as incoherent blabbering, undressing in public, talking to inanimate objects, and he did all of this in full public view. Finally, he was arrested and imprisoned in 1997 after he was recorded, videotaped, and audio as being completely stable, composed mentis, and boasting about his act of mental illness and keeping the police and FBI at bay. As dramatic as this may sound, this is not a completely Western phenomenon. Even in the Indian judicial system, a lot of accused individuals use the plea of mental instability or insanity to escape prosecution. The court relies on the judgment of its medical health professionals to determine whether these individuals are actually suffering from mental illnesses or they are merely faking it. But how do you differentiate between true and false mental illnesses? Now, that's the dilemma. I am going to resolve it for you. Individuals who go ahead and fake mental illnesses generally have an ulterior motive, like staying out of prison, not paying a particular fine, etc., etc. Whereas individuals with genuine mental disorders do not have an ulterior motive. The onset of the symptoms of mental disorders in genuine individuals is gradual and very noticeable, whereas in individuals who are faking mental illnesses, the onset of symptoms is sudden and very exaggerated. History of mental illness in the family or previous history of similar symptoms is generally seen in individuals who have genuine or true mental illnesses, whereas in individuals who are faking mental illnesses, these predisposing factors are generally absent. In individuals who are faking their mental disorders, their symptoms are greatly exaggerated or overdone, so to speak, when they are being actively observed. But at times when they feel that they are not being observed, they act pretty normal. This is not the case with individuals who have a genuine mental disorder. Individuals with genuine mental illnesses are able to exhibit their disorders even at the risk of harm to themselves. To exemplify this, let me give you the example of a movie called as The Joker, starring Joaquin Phoenix. In this movie, the character has a pathological laughter, but he's unable to control that laughter even at the risk of him being fired from his job. Now, this is characteristic of an individual with a genuine mental disorder. But in case somebody is faking a mental disorder, he will be able to control his symptoms and modify them accordingly. Another very important differentiating point between individuals with genuine mental illnesses and those who are faking it is the apprehension towards repeated examinations. Now, individuals who have a genuine mental disorder really don't mind being examined one time or 10, whereas individuals who are faking their mental disorders for some ulterior motive will not respond very kindly to repeated examinations. The examination report regarding the mental status of an individual when submitted to court must be detailed and should include all the relevant points that I've mentioned earlier. Now, I hope I was able to give you a brief overview of the differences between true and false mental illnesses and methods on how to differentiate them. Keep giving me those critical reviews, hoping for your queries and your reviews and your comments on this channel. Keep me updated, keep in touch. Up until next time, this is Dr. Som from Forensic 101 signing out. Ciao!